Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter total.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
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 Drools. Feed real.
Feed clean.
You are able to see the my slide, madam?
Yes, sir. Yes, sir. It is visible. Hello, everyone. Myself, Dr. Shah.
You are able to see my slides? Video, audio? Full screen is there now?
Yes, sir. Now it is full screen.
Audio, my audio, you are able to hear? Video, audio, video. Then I will start. Video is on. Wait. He says you cannot start your because it is disabled by the host. You have to release, I think.
Just
Okay, no problem. I'll be online. Once you say, I'll start.
Yeah.
Hello everyone, myself Dr. Shravani from Drools. I welcome you all to the Drools Vetline Webinar Series 2026, a platform created to support, inspire and empower veterinary professionals across the country. At Drools, we believe that strong, informed veterinarians are at the heart of better pet care. That's why we are committed to enriching the entire veterinary ecosystem from clinical excellence to practical management, personal growth and building strong communications with the pet parents. And before we begin, I request everyone to please fill out the form in the comment box to receive your certificates. This webinar is part of an ongoing series designed exclusively for veterinarians throughout the year. We will address real-world challenges, share practical insights, and support your growth as both medical professional and leader in the animal healthcare. It is my absolute pleasure to introduce our esteemed speaker for today's session, Professor Dr. M. Chandrasekar. Professor Dr. Chandrasekar is a renowned veterinarian with over 25 years of dedicated service to the veterinary fraternity through clinical practice, teaching, administration, and research. He holds an MVSc and Ph.D. in veterinary clinical medicine, along with a postgraduate diploma in orthopedics. He is the president and founder of the Veterinary Emergency and Critical Care Society of India and has been actively involved in several national and international research programs. He is also a pioneer in establishing the first dialysis service for animals and has assisted in setting up a dialysis facilities at Punjab Veterinary University, Karnataka Veterinary University, Telangana Veterinary University, and Andhra Pradesh Veterinary University. In addition to his clinical and academic achievements, he has mentored numerous graduates, supported veterinarians pursuing education and practice abroad, and contributed to several international collaborations. We are truly honored to have him lead today's session and share his vast experience and insights with us. Over to you, sir. Yes, over to you, sir. Yeah.
Can I proceed? Thank you, Doctor, for your excellent introduction. And today topic is CKD Management, Azotemia and Hypertension made practicals. So I'm Dr. Chandrasekar, working in the Emergency Critical Care Unit of Madras Veterinary College. I am also a Joint Secretary of Small Animal Pet Practice Association of Tamil Nadu, taking care of the international affairs, arranging the CE program. And so coming to the chronic kidney disease, you must know the various parts of the kidney, like renal artery, renal vein, renal pelvis, where it is, and the cortex and medulla, and then ureters. These are all the various structure. It will play an important role while you are doing scanning also. This structure presents and their abnormality playing an important role in identifying the pathology. What it is, how it is important, I will show you in the subsequent slides. And you also must know about the various functions of the nephron. So renal corpuscles generate the glomerular filtrate composed by water, ion and small molecules. And you have a proximal convoluted tubules. It reabsorbs sodium, chloride, potassium, water, glucose, amino acid, bicarbonate, calcium and phosphate. It will also secrete ammonium and creatinine. Loop of Henle, thin ascending limb, reabsorb water. Then you have another loop of Henle, thin ascending limb, reabsorb sodium and chloride. And then distal convoluted tubule, it reabsorbs sodium and chloride. And one more loop of Henle, thick ascending limb, it's also reabsorbs ammonium, sodium and chloride. And the final structure is the collecting duct, reabsorb sodium, chloride and water, secrete ammonium, hydrogen ion and potassium. So the nephron is the functional unit of the kidney. There are 40,000 nephrons are there in each kidney. Majority of the problem, these functional nephron damages, whether it is in the glomerulus or in the basement membrane, or in the proximal convoluted tubules, loop of Findlay, thin ascending limb, descending limb, and loop of Findlay, thick ascending limb area, distal convoluted tubule, and a collecting duct. It will play important role in absorbing the sodium, chloride, potassium, water, and glucose, amino acid, bicarbonate, calcium, and phosphate. And it will also secrete ammonium, hydrogen ion, and potassium. When there is a damage to the functional unit of the nephron, you will have disturbances in the all these electrolytes. And this result in renal failure, and you will have the toxic substances accumulated in the animal body. Kidney is the only organ. It will have various functions, like it removing that toxin. It will also secrete the hormone like erythropoietin. It will also play an important role in the vitamin D metabolism, and it's also playing an important role in the renin, angiotensin, aldosterone pathways. And the drugs, what are the various drugs we are using in managing the chronic kidney disease? I will tell you the usage of the drug. When you identify some pathology with your creatinine or SDMA. And most important thing is the practitioner or academicians who are listening these presentations. And whenever chronic kidney disease patients in dog, cat, or any animal, counseling the owner is very important. It is not like other conditions wherein give the drug and send it. It is purely a management. Even US-based study and other places also, till date, the renal transplant also, a lot of failures are there. So as of now, CKD management based on your creatinine, based on proteinuria, based on hypertension, these management restricting the phosphorus, putting on the renal diet is playing an important role. And then Drools, they have come out with the one product called Azoclean. This will also play an important role, controlling the bad bacteria, promoting the healthy bacteria, wherein you can have you can avoid the progression of the chronic kidney disease, and there are a lot of benefit in managing the case. I will play in the subsequent slides at the end, and and it's also they have a product. It will also prevent anemia. Not only having the prebiotic and probiotic, it is also having the product to controlling the anemia. In case of CKD patients, I already told you erythropoietin produced in the kidney. This erythropoietin stimulates the bone marrow and releases the RBC in the circulation normally to avoid anemia. See, in case of CKD patient, erythropoietin production reduced. So it may not be able to stimulate the bone marrow to release the RBC. That is the reason CKD patients, majority of them, they are anemic. So we are going to give erythropoietin or darbepoietin. Recent recommendation, we are giving darbepoietin drug. So this is the pathway. So I will go into the subsequent answers, thereby you can able to understand. And then kidney functional unit, it will filtrate the essential substances from the blood. It also reabsorbs some of the essential nutrient. It will also secrete the waste products. This is the basic functions. And another thing is the definition of CKD, structural and or functional impairment of one or both the kidney that has been present for more than approximately 3 months. They call it as CKD. CKD patients, when they are having the one kidney or two kidney involvement, elevated creatinine, treatment for more than 3 months, they call it as CKD patients. Etiology, there are familiarity incidents, there are acquired incidents, there are congenital incidents that causes this chronic kidney disease. CKD in small animal is a lifestyle disease of senior pets. The incidence increases with the age higher than 7 years, and research showed that around 10% of the dog and cat suffer from CKD at this stage. So more than 7 years, it is that time most of the practitioners, they have a biochemistry machine, they have a ABG machine hands-on. So inform the owner better to screen the patients, especially identify the SDMA, blood urine addition, creatinine, potassium. Majority of the time, after 7 years, they say 10% of the dog and cat are prone to develop CKD. Just by screening, you can able to identify the elevated creatinine or SDMA. Based on that, you can plan the treatment for the particular case. And then, it's a multifactorial diseases. Onset is slow progression and cause more damage to the functional nephron, and thereby reduction the glomerular filtration rate 30 to 50%. It's a vicious circle and a fatal prognosis. Clinical symptoms appear often in stage 2, International Renal Interest Society. Most of the clinical symptoms you can observe in stage 2 category. 1 in 10 dog, 1 in 3 cat, they're prone to develop CKD after 7 years of age. So this is another important slide you can see here. So from kidney, erythropoietin is produced. It will stimulate the bone marrow and releases RBC. So in case of CKD patients, I told 40,000 nephrons are there in each kidney in dog. When they are damaged, they will not be in a position to produce the required quantity of erythropoietin. So it may not be able to stimulate the bone marrow and it will not be able to release the RBC. That is the reason your patient is getting anemia. So majority of the CKD patients, when you are identifying the anemia, packed cell volume less than 20%, hemoglobin is less than 7 or 8 gram per deciliter, those are the patients they need, hormonal replacement therapy by using darbepoetin 0.5 to 1 microgram per kg body weight once a week for 3 or 4 weeks you have to give. There are occasions you can also go for blood transfusion. That itself another class. I will tell you what all the protocol you have to follow and how to manage and all those things in the subsequent slides, subsequent classes. Another important, the previous slide you have seen how the erythropoietin being produced, how it is playing an important role for producing RBC. This is another important slide, how the kidney playing an important role, vitamin D metabolisms. So vitamin D3, that is cholecalciferol made in the skin, found in the oily fish, egg yolk and fortified food. Vitamin D2 ergocalciferol found in fortified feed, salmon fish, mushrooms and egg yolk. These are all in the form of D2 and D3. And then convert D3 and D2 to 25-hydroxy vitamin D in the liver. 25-hydroxy vitamin D in kidney, it converted to 125-dihydroxy vitamin D. See, this 125-dihydroxy vitamin D is the active form of vitamin D. So they need this vitamin D for various functions of the animals, including the calcium-phosphorus homeostasis and metabolism. And when there is a deficiency of vitamin D, there will be a interference in the calcium-phosphorus homeostasis. And the animal may not be in a position to get required quantity of calcium and phosphorus, and there will be a bone deformities, all those things. That is the reason majority of the cases of CKD patients, that means they will not be able to get the active form of 125-dihydroxy vitamin D. That means vitamin D, enough quantity is not available. They get osteoporosis and then thinning of the bone, and you will also get the rubbery jaw. There are occasions if you find the vitamin D level low level, in case of CKD patient, administration of vitamin D also playing an important role. The previous slide, I told you, in case of anemia, you have to use darbepoetin. This slide, if you see a vitamin D less level, this is the need of the time. The practitioner and academicians, they should check a vitamin D level in the serum. If the vitamin D level in the serum is very low, you have to administer the vitamin D to that patients. So this is another important slide. And so in case of CKD patient, the blood flow is low, renin getting secreted from the kidney. That is from the extraglomerular apparatus. This in turn, from the liver, the renin getting converted into angiotensinogen 1 by the angiotensinogen. In lung, the angiotensinogen 1 by the availability of angiotensin converting enzyme, it converted to angiotensin 2. The angiotensin 2 is a potent vasoconstrictor. It increases the blood pressure, and it also, when the angiotensin is 2, there are two pathways. One is increase the blood pressure. Another action, it will also, from adrenal gland, it will also secrete the aldosterone. It will retain the salt, and it will also increase the blood pressure. You understand the pathway? When there is a low blood flow to the kidney, renin getting secreted, and when the renin is in the blood, it converted to angiotensin 1. The angiotensin 1 converted to angiotensin 2 in the pulmonary epithelium, parenchyma, by the enzyme called angiotensin converting enzyme. The angiotensin 2 having a two function. One is it increases the blood pressure. Another one, from the adrenal gland, it secretes aldosterone. The aldosterone, it retains the salt or the sodium. It increases the blood pressure. So the message from the slide, CKD patient checking the blood pressure is very important. That too, you have to use the Doppler blood pressure. Don't use ordinary BP machines, what is meant for the human being. That will not give the clear result. They have made some software modification in the Doppler BP. You go for wet Doppler. If you are anybody coming from abroad, there is a 50% reduction in price. Or if you can affordable, you can buy from here. And then from the pedal artery, you can take the blood pressure. Avoid 1 or 2 reading. Third reading, you can take it for the correct reading of the animal. Then if the blood pressure is more than 150 mmHg, you need to put him on with the angiotensin converting enzyme inhibitor. All enalapril, captopril, benzopril, these drugs is playing an important role. Thereby conversion of angiotensin 1 to 2 reduced. Thereby blood pressure reduces, and it causes vasodilatation. More clearance will take place, more comfort to the patient. It will also reduces the secretion of aldosterone from the adrenal gland, and thereby salt retention also minimized. Thereby you can control the blood pressures. These are all the message from this slide. 2 slides before, the use of erythropoietin importance I told. The next slide, why vitamin D you have to give for CKD patient I told. On this slide, I am insisting you have to check the BP, the low blood pressure, blood supply to the kidney that releases renin. The renin getting converted to angiotensin 1. Then angiotensin 1 to 2 conversion taking place in the lung parenchyma by the enzyme called angiotensin converting enzyme. This angiotensin 2 increases the blood pressure and causes vasoconstriction. This increased blood pressure, it results in multi-organ failure. The most important thing is most of the dog and cat, they become blind. If you don't diagnose the blood pressure on time, they lose the vision. There will be a rupture of the blood vessel that will result in hypema, and they become blind. If you can control the BP well in advance by giving a angiotensin converting enzyme inhibitor drugs like benazopril, captopril, these drugs, thereby, they reduces the blood pressure, the animal have a better quality of life. So this is very, very important, this slide, so that, you can give a comfort to the animal, then you will become a vision to your dog and cat. And then glomerulonephritis, and how the tubular nephritis, histological changes, and then the changes, if you have a doubt with acute or chronic kidney disease, you take a biopsy after getting consent from the owner, whether glomerulonephritis or tubular nephritis or interstitial nephritis, that you can make out by careful histopathological examination and biopsy. How this disease development take place? When there is a nephron loss, it results in hypertrophy of remaining nephron, hyperfiltration will be there, and result in glomerulosclerosis. Disease development final step, it will end up with the fibrosis. Parenchymal destruction, the fibrosis is the final pathway, and end up with the CKD. Glomerulosclerosis, tubulo-interstitial fibrosis, you can encounter in case of CKD patients. You see healthy patients, you have a nice blood vessels, peritubular capillaries, you will see the tubules, you can see the glomerulus, In case of fibrosis conditions, you see the interstitial fibrosis here, glomulosclerosis here, and the arteriosclerosis also you can encounter. So the message from the slide, all these fibrosis, sclerosis happen in case of chronic kidney disease patients. If you can diagnose the problem early, if you identify the etiology, this can be reversed. If you don't identify the etiology, it can end up with the chronic kidney disease. So that is the reason I told at the beginning of my presentations, periodical after 7 years, periodical evaluation of your creatinine, periodical evaluation SDMA. Most important thing is examining the urine. If you see the proteinuria, and that will give you a clue about the presence of ongoing kidney disease in that particular animal. Then UP, urine protein creatinine ratio, if it is more than 0.5, again it tell you about the chronic kidney disease. And then blood pressure is more than 150, again it is a giving clue about the chronic kidney disease. Then SDMA, creatinine, already you know. So urine examination, especially urine sediment examinations. So veterinarian nose to tail examination is very important. CKD patient means just by examining the creatinine alone, don't send it. You need to examine nose to tail. What are the observation you can see, from the, if there is an animal having hypertension, there will be a bleeding. Epistaxis will be there in nasal cavity. The animal with the chronic kidney disease, they have a oral ulcer. Then you will have a glossitis, tongue inflammations, and gum ulcers. And there are occasions there will be a bleeding tendencies. And hypema, collection of blood in the anterior chamber of the eye. And when you examine the neck and the shoulder, if there is a demineralization, there will be a painful episode when you are palpating. And then when you examine the jaw, there will be a rubbery jaw. And there are occasions, when you examine the heart, CKD patients, there are pericardial effusion also, there are reports. So you will have arrhythmias also, first degree, second degree AV block also you can enter. There are occasions when the kidney is shut down, there will be a volume overload, you will have a pleural effusion also. Then when you auscultate, you will get a pruritic friction rub. And then palpating, the right kidney is cranial, left kidney is caudal. A right kidney covered by the caudate lobe of the liver, you cannot palpate, but the left kidney you can palpate. In case of cat, you can palpate the kidney very easily. But dog is quite challenging in obese animal. Right kidney you cannot palpate, left kidney you can palpate. And then if they are having any, growth or renal failure patients, when you touch the kidney, they evince pain. And the mid-abdomen, you have jejunum and ileum. And then when there is an inflammatory condition, they will have evince pain. Caudal part of the you have a urinary bladder. There are occasions, calculi also can cause renal failure. And then in our country, there are more amount of hemoprodustion. You have a Babesia zibzoni, E. canis, Anaplasma platis, and all these rickettsial disease, it causes functional nephron damages, reduced blood flow to the kidney, and the RAAS system getting activated. You will have a high BP, and if you can identify this etiological agent well in advance, you can control the problem. You can control the blood pressure. You can control the proteinuria. You can control the phosphorus level. Animal have the longevity of life. When you look into the cellular activation and injury, fibrogenic signaling phase, fibrogenic phase, renal destructive phase encountered in CKD patients. In this slide, you can see there is an increased intraglomerular pressure due to various reasons, result in hypertrophy, capillary wall stress, podocyte detachment, loss of nephron, decreased glomerular filtration, hyperfiltration, endocytosis of protein, pro-inflammatory cytokine release, necrosis or apoptosis, tubular apoptosis, and detachment. This result in de-differentiations. And this is the way the cellular level changes encountered in CKD patients. And then coming to this slide, chronic kidney disease, whatever I told, they summarized everything here. Chronic kidney disease also end up with anemia, and the anemia result in interstitial hypoxia. And in turn result in chronic kidney disease also develop a systemic hypertension. This hypertension result in intraglomerular hypertension and hyperfiltration. Systemic hypertension result in proteinuria, This also results in glomerulosclerosis, interstitial fibrosis. Nephron loss, this releases angiotensin 2 level increases, efferent arterial constriction, and arterial dilatation. These changes are encountered in case of chronic disease patient. These we explained to in the previous slides. Then another thing, progression variable, there will be a proteinuria. You see the plasma membrane, pinocyte vesicle. Pinocytosis vesicle forming in cell lining a small blood vessels. And then when you look at the histopathological, biopsy slides, you can see the tubular protein cast also. So I have been telling you in the beginning, you collect the urine, male dog. They say the best method of collecting urine, cystosynthesis. Voiding urine, many times there will be a contamination in the prepuce or in the vaginal region, vulval lip. Catheterization, you can take the infection inside. They advise to better go for cystosynthesis. And then male dog, lateral to the penis, catch hold the, immobilize the bladder, introduce the needle and aspirate the urine. In case of female dog, in between the last two nipple, immobilize the urinary bladder, introduce the needle and collect. This is the gross anatomic locations. Now ultrasound available everywhere with all the practitioners, so that with the ultrasound guidance you can locate the urinary bladder, introduce the needle and collect the urine. Because the idea of doing ultrasound guidance is the urine is sterile. So what physical chemical properties are the changes, you can clearly identify. Even the organism involvement also you can subject for a cultural and sensitivity test. The most important thing is you centrifuge the urine. In the urine, you identify whether a tubular cast is there or any abnormalities, or if you find more number of neutrophils. This will give you a clue about the treatment plan. That's the reason I always insist, examine the urine, perform the physical chemical properties test, and then sediment examinations playing an important role in predicting the ongoing problem to the particular, especially CKD or AKI patient. This is very, very important. Then this, as I told already, this will also, CKD patient, they have a glomerular hypertension, systemic hypertension, intrarenal hypoxia, mineral and bone disease associated with CKD, oxidative stress encountered in CKD patients. Clinical sign, they have a polyuria, polydipsia, weight loss, stunted growth, inhabitants, vomiting. These are all the classical signs encountered in case of CKD patients. And the AKI patient, CKD patient, when you compare, AKI patients, there won't be any weight loss will not be there. In case of CKD patient, there will be a weight loss. And the CKD patient, they have a uremic ulcers in the mouth, and there will be a glossitis. These are all the classical clue, and they have a stunted growth also. And then they have a rubbery jaw. And then when you examine also, they have a pain on the bone, because I told, it will also interfere with the calcium-phosphorus metabolism. It increases the more amount of phosphorus, reduces calcium, parathyroid hormone playing an important role. Hyperparathyroidism also encountered in CKD patients. And you see in the slide, the CKD patients, anemia. You can see the buccal mucosa is pale, tongue also pale in nature. Increased water consumption and urination, early sign of kidney failure. Majority of the time, water intake, they may not be knowing, but increased urination every time when the dog want to urinate, whether you are staying in the apartment or individual house, there always a dog try to call you to take it out. The more number of your frequent visit, think about identify the think of CKD and check the SDMA and creatinine values. And you see the uremic ulcer and the glossitis in this patient. And you can also see the cachectic and emaciated nature of the animal. Systemic complication is also result in cardiovascular renal axis disorder due to hyperkalemia, more amount of potassium. Already I told it results in arrhythmias, first degree block, second degree block. So this hyperkalemia results in cardiac arrest and death of the patient also. So the potassium is an intracellular element, electrolyte. When excess amount present, it comes out of the cell. So by giving the proper treatment, the potassium, if it transferred in the cell, You can avoid the cardiovascular renal axis disorder. Anemia, we have a lot of product. I'll tell you in the subsequent. Hypertension, we have a product. Hyper or hypovolemia, how to manage and everything we'll tell you. If there is a cardiovascular renal axis disorder, you check for a cardiac troponin level. Nowadays, many practitioners, they using a Doppler, they having a blood gas machines. Those who are not having no better buy the blood gas machines. It is you can get from 3.5 to 4.5 lakhs. But that is very important. Bedside, you can able to identify the organ involvement, except the liver enzyme. All other things you can identify: cardiac involvement, renal involvement, hyperkalemia, diabetes, hypoglycemia, blood gas changes, hypoxemia, and all these observations within a minute you can get it in your fingertip, so that it is easy for you to give the message to the owner also. So, in case of cardiovascular involvement, you can check for cardiac troponin level for myocardial injury. NT-proBNP elevation, it will tell about the myocardial stretch. So, for this identification, there are ready-made kit is available. You have to get it, add a small quantity of blood into the cartridges. The high-stat and the EPOC, they have the cartridges for that. You load that within a fraction of a minute, you will get the result. If you see a high level of troponin, you can think about cardiac involvement like that. And then already I told about the clinical sign of CKD, polyuria, polydipsia, dehydration. They are less active, reduced appetite, weight loss, vomiting, bad breath because of the excess amount of uremic toxic substances, ulcer in the mouth, and pale mucous membrane, anemia. And then staging of chronic kidney disease, they classified based on creatinine concentration. And in case of cat, less than 1.6 milligram per deciliter, they say it is stage 1. In case of dog, less than 1.4 milligram per deciliter, stage 1. In case of stage 2, cat 1.6 to 2.8. In case of dog, 1.4 to 2. In stage 3, moderate renal azotemia, 2.9 to 5 in case of cat. Dog is 2.1 to 5. Stage 4, severe renal azotemia, more than 5 in cat, milligram per deciliter in cat, more than 5 milligram per deciliter in case of dogs. Why this chart is very important? If you identify the creatinine value 1.6, more than 1.6, that means stage 2 in case of cat. In dog also 1.6 come under stage 2. So you call the owner, inform them this is stage 2 kidney disease. It has to be managed with certain guidelines. Like you have to check the BP, we have to do ultrasound and check the kidney architecture. We need to do a urine analysis. You need to check the blood pressure. When you check the blood pressure, there is a certain guideline of treatment you have to give. If you see a proteinuria, there are certain drugs we have to give. And then if you check the urine culture and sediment examination, there are certain planning of treatment. And if you check the vitamin D also, if it is low, then vitamin D administration is also a very important role. There are certain feed reduces the renal phosphorus, phosphorus restricted renal diet we can recommend. These are all the observation, you need to make out just by, checking the creatinine alone. Secondary renal hyperthyroidism is encountered in CKD patients. And then you see chronic kidney disease, it reduces renal phosphorus clearance and result in hyperphosphatemia. It increases fibroblast growth factor 23 also. This hyperphosphatemia increased fibroblast growth factor 23. It reduces 125 dihydroxy vitamin D. Already I told you 125 dihydroxy vitamin D. It is a active form of vitamin D. When it is reduces, it results in hypocalcemia. I told vitamin D playing an important role in the calcium and the phosphorus homeostasis. And then when there is a high level of phosphorus, it reduces the 125 dihydroxy vitamin D and result in hypocalcemia. And this hypocalcemia, when there is like, remember the milk fever in cattle, when there is a calcium level is low, parathyroid hormone is secrete, and it depletes the more amount of calcium from the stored surfaces. From the bone, it will also absorb more amount of calcium from the feed, from the gastrointestinal tract. This is the way the normal homeostatic mechanism, parathyroid hormone, playing an important role in hypocalcemia. Here also, when there is hypocalcemia, parathyroid action is more, but it results in enlargement of parathyroid gland. And this is the way, secondary hyperparathyroidism encountered in chronic kidney disease patients. And then this will also result in acid-base electrolyte disturbances. It will also result in uremia, impaired renal hormonal synthesis, and the majority of the CKD patients, they prone to death urinary tract infection also. Gastrointestinal consequences of CKD, majority of the CKD patients, they will not reach. There is an anorectic factor, serum leptin level elevation that result in anorexia. Vomiting is because of the chemoreceptor trigger zone stimulation and result in uremic gastritis. Gastropathy, reduced renal clearance of serum gastrin, result in gastropathy. Dysphagia, difficulty in taking food encountered in CKD patient. There are occasions you will have a uremic enterocolitis. The pathophysiology of secondary parathyroidism, chronic kidney dissipation, high level of phosphorus, reduces 125-hydroxy vitamin D, reduces calcium level, parathyroid hormone getting into actions to keep the calcium in balance. And it will also take calcium from the stored bone surfaces when there is a low calcium. Already I told you different with ARF and CRF, but even then, coming to the renal function, sudden decline in case of ARF, in case of CRF, not able to perform regulatory and excretory function. And then onset of disease, sudden in case of ARF, in case of CRF, slow and progressive, but damage is more. Signs, oliguria in case of ARF, CRF is polyuria. And in case of anemia, in case of ARF patients, may not be present. In case of CRF patient, mostly occurs. Recovery potentially reversible if you can know the cause in case of ARF. In case of CRF, potentially irreversible. Specific variety of urine increase in case of ARF. In case of CRF, decrease. So estimation of specific variety is also very important in case of CKD and AKI patients. Damage to the functional nephron, 35 to 50% nephron damages. In case of CRF, 70 to 80% functional nephron damages. In case of ARF, prognosis favorable. In case of CRF, doubtful. So always, because owner will be coming to you for several years for CKD patients. So you should give them counseling. You should explain to them based on the parameters, based on SDMA, blood urine nitrogen and creatinine, elevated potassium and phosphorus. Explain to them what is your plan of action so that you can also give the pamphlet about the CKD patient management and they will be convinced that they will become your permanent client. And then this again, diagrammatic representations. If there is a underlying cause that result in nephron loss, result in proteinuria, intraglomerular hypertension, result in fibrosis, hyperphosphatemia, and then this nephron loss reduce the life expectancy. This nephron loss, there is azotemia, uremia, reduced quality of life also. This is the changes at cellular level. You see the healthy kidney, you see the fibrosed kidney. Initial injury, activation of macrophages and lymphocytes, and this in turn, it increases the tumor growth factor B, proliferation of fibroblast, increased collagen synthesis, and result in fibrosis. Another pathway, that the activation of macrophages and lymphocytes, it will also secrete tumor necrosis for interleukin 1, interleukin 4, interleukin 13. Increased collagen synthesis, they result in fibrosis. This is about the cellular level actions. Alteration of biochemical parameter in CKD, hyperphosphatemia, this we told you already. Excessive excretion through urine result in damaged kidney. Azotemia, you will have elevated urea and creatinine. Imbalance in electrolyte balance. This we explained to you in the first slide itself. How it will filter the substances from the blood, how it reabsorbs glucose, amino acid and phosphate, and how it secretes sodium chloride, potassium bicarbonate, and what is the action in thin ascending limb and thick ascending limb, and also in the collecting duct. Diagnosis. So as done till date, they say symmetrical dimethyl arginine estimation is the yearly marker. In case of dog, if the value is less than 18 microgram per liter, stage 1. Cat also same. 18 to 35, stage 2. Cat is 18 to 25. In case of Dog 36 to 54 stage 3 SDMA. In case of cat 26 to 38. In stage 4 more than 54 SDMA. In case of cat more than 38 microgram per deciliter. The message from this slide based on the SDMA, they say because the latest available research paper, what they insist, creatinine level elevation, SDMA normal means you can say animal is in the healthy conditions. If the SDMA level is high, creatinine is normal. You have to teach them that is that animal is having the kidney disease, because less than 18 microgram stage 1. Above that, if the animal is in the stage 2, 3, and 4, so it needs a treatment. It's management, for CKD. So another important renal biomarker is what we have in the practitioner level is the creatinine. It's the breakdown product of muscle elevated in cachexia, and when an animal fed with ascorbate, pyruvate, glucose, bilirubin, ketoacids, also it get overestimation. When they are animal with the cephalosporin, aminoglycoside, trimethoprim, phenazide, also there will be a false elevation. Dog fed with the cooked meat also elevate level of creatinine. And when you use corticosteroid, also elevation. Elevated muscle metabolism also increases creatinine. Dehydration time also it get elevated. So see that these parameters are not there in the dog while you are examining while you are taking the blood for creatinine estimation. And excluding all these factors, if the creatinine level elevation persistently, then you can think about kidney disease in that particular patient. Symmetrical dimethylated arginine, the normal level they say dog 9.8 microgram per deciliter, cat 9.6 microgram per deciliter. The advantage of the SDMA, it detects kidney healthy issues with as little as 25% of the kidney function losses. But creatinine, when there is a 75% function loss, only creatinine getting elevated. The message from this slide, keep SDMA as the first biomarker for estimating the kidney disease. Then rest of the other biomarker, you can keep it secondary line. Studies prove SDMA detect kidney disease earlier than creatinine. This already I told you. This grammatic reference. Then another biomarker, neutrophil gelatinous associated lipocline. This value is 12.7 nanogram per ml. This is we are using for research-based activity. When there is involved renal tubular regeneration post-injury, it gets elevated. Lack specificity in carcinoma, lymphoma, also it causes elevation. Useful prognostic cater in case of CKD. So research-based level we used for NGAL for some student. And cystatin C, this also normal level is 0.4 to 1.6 milligram per deciliter. Cat 0.58 to 1.59 milligram per deciliter. It produced by all cell, filtered through the glomerulus, reabsorbed from proximal convoluted tubule and degraded. Urinary level extremely low and proteinuria influences. So there is a urinary exosomal non-coding RNA. The urinary exosomal miRNA, it get elevated in case of renal fibrosis. It's available in the research-based placed. The another important thing is this already told you that blood gas estimation. This is the machine we frequently use. This one we are using. We use iStat machine also. These cartridges you will get it for 250 or 300 rupees. The MRP is 500. What you have to use, these cartridges you have to load it on the slot after taking the heparinized from the artery. And always try to take from the blood from the artery. It will give a true status about the patient, whether the anemia, whether the hypoxemia, whether the respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis, or hyperglycemia, hypoglycemia. Those observations within a 2 minutes, you will get it in your hand. You can show it to the owner. You can plan the treatment. So always those who are having better practice, try to buy this. And once you buy, improve your skill in collecting the blood from the artery. You can also check from the venous blood. Venous blood, the oxygen level will be low. Arterial blood, the oxygen level will be high. This is the two difference. Artery and venous blood will be black in color. Arterial blood will be pure red in color. This is the gross observation. try to improve your skill, and you make use of us the interpretations, or how to load how to collect, how to load also. We can have a practical demonstration. As and when you get the machine, you can inform us. This is another wet Doppler, which I told you beginning of my presentation. When you don't identify the blood pressure, the increased blood pressure result in blindness in cat and hepatic failure, multi-organ failure in dog and cat. So it is better to estimate the blood pressure. You can save the pedal artery, vein and the artery. If you keep your finger on the artery, there will be a dominant pulsation will be there. The dominant pulsation will be, you keep the sensor, there will be a hissing sound will be there. Then corresponding limb, you create a pressure by applying an inflation cup. Once you increase the pressure, that hissing sound will reduce. And slowly you release, you will get the hissing sound. You leave the two values, take the third value. The third value will be the systolic blood pressure of the animal. Up to 140 stage 1, and more than 140 stage 2, 3, 4, like that, the classification. More than 180 severe hypertension, they needs continuous monitoring, and you have to bring down the blood pressure so that you can save the vision of the animal. We can save the multi-organ involvement of the particular animals. So ultrasound is playing an important role in detecting the chronic kidney disease. In case of chronic kidney disease, there will be increased heterogeneity, irregular contract, decreased absence of corticomedullary differentiation, and then renal volume also reduced. You see the normal kidney, you see the cortex and medulla. Outside also you can see the periphery normal. And this will not be there in case of chronic kidney disease. You see a slide here. There is a multiple cyst in the kidney. In one of the dog, it's having polycystic kidney disease. It's a hereditary problem. And with the naked eye, you cannot able to make out. With the ultrasound, you can able to identify this problem. You see here, increased corticology correlate with the glomerulosclerosis and fibrosis. You see the sunken kidney, and you can see the increased cortical echogenicity. And then length and width, this parameter, it may not help in day-to-day practical purpose. But the volume, usually decrease in case of CKD, increase in case of polycystic kidney disease, neoplasm, amyloidosis, leishmaniasis. So you have to measure the length, width, and the diameter, and then you have to multiply it to 0.523. And this is the research-based data. It may not be useful for the general practitioners. And then irregular border, you look at the outer cortex of the kidney. You see here, there will be a outside the adjacent to the spleen. You see the irregular border. This you have to identify due to scarring and fibrosis. This finding is more common in the more advanced stage of the disease, indicating a poor prognosis. You see the contracted kidney here. And then there are occasions you will also see the medullary rim sign. Between the cortex and medulla, you are able to see the medullary rim sign. And then color blood flow to the kidney. So forget about the recessive index, the pulsatile index that we are using for research-based data. Normal RA in adult dog 0.56 to 0.67. Pulsatile index 1 to 1.3. What we do, we just apply the color flow button. And for practitioner point of view, whether healthy kidney, you will see the more amount of color uptake. You see the red and blue. In case of chronic kidney disease, you will not be able to see this much of color uptake. And in case of chronic kidney disease, the RA and PA will be more. What we do, we just keep the colored Doppler and press the pulse wave Doppler. And once you press the pulse wave Doppler, the peak is the systolic velocity and the down is the diastolic velocity. So the RA is 0.6 to 0.7 is normal. PA 1 to 1.3. Nowadays, the high-end machine, we can able to just by clicking the systolic and diastolic velocity, you will come to know the RA and PA. And mostly it will be increased in case of chronic kidney disease. The message to the practitioner, if you have a color Doppler machine, just apply the color Doppler. And if it is the color uptake is more, then that means it's a healthy kidney. The color uptake is low, that doesn't have that much of healthy kidney status. And advanced stage of chronic kidney disease, hypovascularization, intravenous vessels are hardly visualized with the color Doppler. This is the way they need to measure the systolic, and this is the way they measure diastolic velocity. Then urine protein-creatinine ratio. So normally, the non-proteinuria less than 0.2. In cat also 0.2. Borderline proteinuria 0.2 to 0.8. So in urine, you have to estimate the urine protein and creatinine ratio. So normally if it is less than 0.2 is normal, more than 0.2 borderline, more than 0.5 is proteinuric. So this is also very important. Once you see the proteinuria, you have to put him on the angiotensin converting enzyme inhibitor. Thereby it reduces proteinuria and it preserves the kidney function and it will avoid the progression of the kidney disease. Microalbuminuria concentrations protein greater than normal below the deduction level. Upper limit 30 milligram per deciliter. Previously, they used microalbumin also is important biomarker for identifying the chronic disease. Upper limit is 30 milligram per deciliter. More than this, you can think about ongoing kidney disease in this particular animal. And then regarding the blood pressure, I told you how they are measuring. Normal pressure less than 150, borderline 150, 159, and then hypertension 160 to 179. Severe hypertension is more than 180. So this is the way the blood pressure in dogs and cats they are measuring. And then if you have the so if the BP is more than 150, it needs your AC inhibitor. That's the message about the slide. We have given enough information in the previous slides. Urine specific gravity CKD is 1.006 to 1.020. In advanced CKG, it will become 1.008 to 1.012. The treatment recommendation CKD in dogs. Complete history taking is very important. Nose to tail examination is very important. Counseling the owner is very important. In CKD patient, hydration therapy is very important. And then managing the electrolyte acid-base stasis is very important. And diuretics, animal which are unable to not voiding the urine, using of diuretic is very important. Management of nausea and vomiting. So you have a maropitin, you have a ranitidine, metoclopramide, ondansetron. These drugs, it will help you to reduce the vomiting and nausea. And previously I used ondansetron. Now the availability of maropitin, that can give a better control over the vomiting. Controlling serum phosphate and calcium level through diet is very important. There are several phosphate diet marketed by Drools. It is available. Renal diet that you can buy. It is available in the form of granules. It is available in the form of gel, wet also. That you can buy. It depends upon the availability. You can give acceptance by the patients. So minimizing proteinuria by renal diet. Management of anemia, you can use erythropoietin or darbepoetin. Nowadays, we are using darbepoetin. If there is a systemic infection, renal safe antibiotic you have to use. Dietary intervention is very important. Improve the life expectancy of the patients also is very important. There are antifibrotic agents that are commercially available that also you can use. Always removing the root cause is very important, especially nephrotoxin drug. Management of dehydration. Normally, there is a CKD patients. We check the potassium normal, animal is dehydrated, we'll put him on the ringer's lactate, 10 to 20 ml per kg body weight. Like that, we maintain the patient for 5 to 6 years. But we have to give the fluid therapy. And, controlling the hypertension, we use ACE inhibitors. Controlling proteinuria, again ACE inhibitor. Reduction of phosphate intake, phosphate binder. There are several phosphate binders that are commercially available that you have to use. Correction of metabolic acidosis, we use sodium bicarbonate. Correction of anemia, we use darbepoetin. Fluid therapy, as I mentioned earlier, ringer's lactate, we use 22 milligram per kg body weight. After rehydration, maintenance fluid with the lower sodium concentration also is very important. This slide already we discussed. This also already. This is the darbepoetin commercially available. You can use in case of anemia patients. This is our hemodialysis unit. Anemia, in a patient which are uncontrollable uremic crisis, we subject them for intermittent hemodialysis. This machine also available in my own hospital. And CRRT, this machine also available in my own hospital. Patient which are willing, we can subject them for, this is having a multiple role. A small patient also, we can subject continuous renal replacement therapy. This is playing an important role in case of patients which are having snake envenomation. Though you are given the antivenom, but some of the animals, they end up with renal failure. So, because we have to remove the snake venom protein, that snake venom protein effectively removed by these dialysis machines. Human patients, left and right, they use for snake envenomation patients. So, similar applications are available. We a couple of patients we saved. Cobra bite cases. That Ranjani Aridas case, she brought from Kerala, we saved from viper bite. And then similarly, many patients, one Pudukkottai, one human doctor, he brought the dog to my hospital. And we admitted the patient for 1 week. We made it all right. And then because human practitioners, patients, their pet dog is having renal failure, it is easy for them to convince, they understand the pathophysiology. For others, you need to give them counseling, and then they should understand. So those who are having enough money, buy these machines, and the smaller patient can be useful. Unknown poisoning cases, there are activated charcoal coated cartridges. This CRRT kit, it can absorb the toxin. Similarly, interleukin 1, interleukin 14, all these inflammatory material can be filtered by this, there is a kit called Oxuris kit. That kit can absorb this toxin, so the patient's sepsis can be minimized. There are various applications this can be used. Even hepatic dialysis also they use. Hepatic failure patient, if you remove the toxin, this machine playing an important role. And human patient critically care unit, majority of the hospital, they have this CRRT machine. It is also available with us. Because all these consumable quite expensive. All the consumable, the kit costs 25,000 rupees. But the owner, pet parents, affordable, and the thinking about the critical conditions. And if you tell the pros and cons, the agreeing owner, we can make use of this machine, and yearly intervention, you can make the animal to become all right. This itself, 1 week course. Then patient, those who are not having money, you can also go for peritoneal dialysis. The peritoneal membrane playing an important role, wherein it's like an artificial kidney. It removes the toxins through diffusion and ultrafiltration, and then the waste product can be removed through another route. Depends upon the staging, phosphorus level concentrations. Stage 1, 2.5 to 4.5. Stage, as the stage increases, the phosphorus level also will increases. Then these are a few slides about the recently the Drools, they come out with the international product to Indian market to tie up with the international brand. There is a drug called Azotemia, and this composition, Streptococcus thermophilus, Lactobacillus acidophilus, and Bifidobacterium langum, and lactoferrin. And these substances, one by one, I'll show the role of these are probiotics. Streptococcus thermophilus utilizes urea, uric acid, creatinine as a nutrient for growth and survival. So, renal failure patient, you have a high level of urea and creatinine, but these bacteria, they utilizes for the growth, so that the uremic crisis can be reduced. Lactobacillus acidophilus reduces concentration of toxin, methylamine, nitrosamine, and several other carcinogenic amine, and help to prevent the growth of pathogenic bacteria in small bowel. So, Lactobacillus acidophilus, it prevents the growth of pathogenic bacteria. Bifidobacterium langum utilizes the various phenolic, indolic, metabolic toxic compound in colonic region, as it is a nutrient for the growth. So, it will these bacteria, Streptococcus thermophilus, Lactobacillus acidophilus, Bifidobacterium langum, they are utilizes the urea, creatinine, and they reduces concentration of toxin. It utilizes various phenolic and endolic metabolic toxic compound in colonic region. It will helpful for the chronic kidney disease patients. So, Azotemia, it corrects the dysbiosis, reduces the level of uremic toxin, LPS, and oxalate, increase the level of short chain fatty acid, improve the gut permeability and prevent the entry of toxin in the blood, delay the progression of CKD, reduce the risk of cardiovascular disorders. So this is the way the Azoclean playing an important role. The international product through Drools, it is available in the Indian market. It is having multiple role. The another ingredients, lactofree, is a natural non-heme ion binding cationic glycoprotein belonging to the transferrin family. It has 300 times higher affinity for ion versus transferrin. It can retain ion at pH less than 4, such as in the gastrointestinal tract or inflammatory lesions. Lactoferrin bind to two ions, enhances the absorption of ion. It entered the intestinal cell through its own receptor and release the ion there, which it is transported to the circulation via transferrin. So lactoferrin transported as a transferrin to the circulation through the various mechanisms. So the Azoclean is also contain lactoferrin. It's a non-heme ion, so it will prevent the anemia to the CKD patients. And the lactoferrin multi-targeted action that protect the kidney, correct anemia, reduces inflammation, support the gut-kidney axis. Now you see a renoprotective nature of the lactoferrin. It protects kidney structure and function, incubate tumor growth factor B1 signaling, activate AMPK, promote autophagy, and outcome is suppression of renal fibrosis, reduces renal atrophy, prevent AKT, acute kidney disease to CKD progression, protect kidney, preserve function, slow CKD progression. It is also prevent anemia, improves anemia and iron homeostasis. Mechanism, regulate epsilon ferroportion axis. Enhance iron availability for erythropoiesis. Increased hemoglobin level, restore iron balances, addresses non-regenerative anemia common in CKD, improves oxygen delivery, reduces fatigue. Then another function is anti-inflammatory, antioxidant property. It reduces inflammation and oxidative stress. Mechanism, lower cytokine level, interleukin 6, reduces RVOs and oxidative stress. Protect renal cells. Outcome is decreased inflammation, limit oxidative damage, slow kidney disease advancement. Protect kidney cells, slow disease progressions. It's also anti-uremic, reduces uremic toxin, mitigate catabolism, mitigate gut diabetes, lower microbiota, derived toxin, especially endoxyl sulfate, attenuate uremic sarcopenia, and the outcome is decreased uremic toxin load, improve muscle mass and strength, enhance overall well-being, reduces uremic burden, improves strength and vitality. And another important function, it is also supporting the gut, support the microbiome balance and host defense, and mechanism, modulate gut microbiome balance, enhance antimicrobial activity, support gut-kidney axis. Outcome is improve gut barrier function, reduces pathogenic load, indirectly benefit kidney health, strengthen the immunity and gut health to support kidney functions. So overall benefit, multi-dimensional protection that address key CKD pathway to improve the quality of life and outcome. So the Azocleans, rational for the combinations, have a probiotic and the lactoferrin. The probiotic reduces the gut dysbiosis and the production of uremic toxin reduces, modulate the kidney axis, reduces further damage to the kidney, help delay the progression of CKD. Lactoferrin that is available in Azoclean act as an anti-inflammatory and a prebiotic, reduces systemic inflammations. Why Azoclean? Veg capsule improves survival of prebiotic. They are acid resistant. They protect the live bacteria from RAAS stomach acid, ensuring a high number of viable microbes reach the intestine. Superior moisture resistant. Gelatin capsule can have a high moisture content, which can activate probiotic prematurely, leading to their death before consumption. Veg capsule generally have a lower moisture content, providing a more stable environment that keep the bacteria dormant and alive, often reducing the need for refrigeration. Protection from environmental factors. These capsules are superior at shielding the sensitive light culture from oxygen, light, humidity, ensure better stability during storage. Why AzoClean? So, Biofrax Healthcare is an industry member within the International Probiotic Association. It has a 50 years experience and strength in probiotic research and innovation. The Biofrax is the partner. They have an international nearly 50 years of experience in the probiotic research and innovation. It is a reliable partner who offer high quality probiotic which provide a comprehensive suite of tailored solution to support your probiotic development. Bioprax Healthcare leverages its membership in the International Prebiotic Association to foster longer partnership. Lactoferrin is a natural non-heme binding cationic glycoprotein having 300 times the high affinity for iron, act as a renoprotective, anti-anemic, and reduces anemia and inflammations. The dosage of AzoClean up to 10 kg 1 capsule daily, 10 to 20 kg 2 capsule daily, more than 20 kg 3 capsule daily. It is a presentation available. There are 3 into 10 capsule in the presentations. These are all the nutshell informations about the CKD protocol and its management. So the message from the practitioner: CKD patient after 7 years, examine the SDMA, creatinine, calcium, phosphorus, vitamin D, Doppler BP, urine examination, sediment examination, echocardiography, because there are occasions CKD patient also prone to develop cardiac arrhythmia and pericardial effusion. Echocardiography, lung ultrasound, then lung ultrasound itself a one day class I can take. So that will keep it separate. Lung ultrasound to identify the pulmonary congestion edema you can make out. When there is a renal shutdown, the fluid accumulation in the systemic area that result in pulmonary edema also. And then phosphate binders, renal diet, and use of AzoClean. AzoClean, how the bacteria that are present, it will reduce the harmful bacteria, how it will benefit the CKD patient, how it will reduce the progression of the CKD, and the use of lactoferrin that are present in the AzoClean, how it reduces the anemia. So this combination of knowledge is very important in managing the CKD patients. And the equipment which I mentioned, Doppler BP, ultrasound examination of the kidney, urine examinations, and then ABG usage in chronic kidney disease patients. It's very, very important. This is the need of all the practitioners. They can start renal consultancy separately because it is a year-long business. So you need to concentrate. Any help, my number is available in the first page itself, available in the Drools also. You can contact me. You don't call me, you can text in the WhatsApp. So once we are free, we will be in a position to help you and establish your business in your area also. Thank you very much. And with this, I'll conclude. I will check any questionnaires that are present, we'll be in a position to so Nandan asked, what will be the cost of dialysis machines? So the intermittent hemodialysis cost start from 7 lakhs. But, if it's CRRT, it costs 30 lakhs. What anesthetic protocol that you use prior to hemodialysis? See, normally avoid putting any anesthesia or anesthesia protocol. Normally what I use now, I give propofol to put the catheter. After that, mild dose of propofol I'll give so that keep the dog calm down. And our friend, somebody mentioned Bun 104 creatinine 7 phosphorus 13 he is having severe azotemia hyperphosphatemia. Earlier this creatinine level, but now is increased to 7.9. In recent report, he is having cyst also in the prostate gland. He is having hematuria and melena also. Today he had seizure also. How I should approach this case? What should be my plan of action? Please guide me. Good evening, sir. I was presented the 9-year-old beagle already told. So, see, already 9-year-old. And then creatinine 7.9. Then CKD advanced stage. Phosphorus is 13.9. And animal is having epilepsy also. Put him on with the Gardinal. And then these cases, better take them for dialysis so that you can reduce the uremic crisis, or you can refer the case to us. And level of calcium increase or decrease in case of CKD. See, when the phosphorus level high, calcium level is low. How are diuretic useful in chronic kidney? Even when the kidney are damaged, do they have any side effect? See, diuretics having a role when the animal is unable to avoid urine, you can make use of Lasix 1 to 2 milligram per kg body weight. If there is obstruction, you are not supposed to use. But other conditions, you can use the diuretics. These are all the questionnaires asked by the my participant. And okay, Drools, anything else? Hello? Hello,
Yes, sir.
doctor.
Yes, sir. Yes, sir.
Can you hear me?
Yes, sir. You are audible.
Whatever the questions they asked, we answered everything.
I think there is one more question also, sir. Now that somebody has posted.
And then certificate, you put Dr. M. Chandrasekar, Professor, Emergency Critical Care Unit, and President, Veterinary Emergency Critical Care Society. In the
Yes, sir.
emergency critical care area, first you show me the rough certificate, then we'll give it to the participant. Okay?
Okay, sir. Okay.
So with this will conclude.
Yes, sir. I think there are few more questions, sir.
I will answer. Thank you very much for Drools for giving
Yes.
these opportunities. And how the muscle wasting in CKD patient apart from the renal diet. See, muscle wasting, if the renal diet, it is not a wholesome food. It is a phosphorus restricted diet. It doesn't contain all the nutrient. So, and the CKD patients, they start utilizing their own body resources. And also why there is wasting, I told you, high level of phosphorus reduces calcium, bone mineral, the changes are there. That will also causes, this type of emaciations and other structures. I would like to ask question regarding AC inhibitor in case such as except in case AKI, CKD. How do you distinguish the difference when to use, when to stop the medicines? So AC inhibitor, especially they say benazopril will be better. If the BP is more than 150, you can very well start with the dose of 0.5 milligram per kg body weight. And you need to start twice a day. You start for a couple of days, then check again. If they are reducing the BP, maintain with the one drug itself. If they are not helping, you can combine with the calcium channel blocker. And there are occasions AC inhibitor combined with the angiotensin receptor blocker also. We have tried AC inhibitor one group. We have tried receptor blocker one group. We have tried AC inhibitor with the calcium channel blocker with one group, like amlodipine. But we found a good success rate in its AC inhibitor alone. So there are varying reports are there that, the message to Anjali, you kindly, whenever you see high level of phosphorus, high level of BP, put him on with benazopril, 0.5 milligram per kg body weight, twice a day. And the Dr. Karthik asked, can we add a chicken-based diet for CKD? So better renal diet will be better, but some people are chicken breast with rice, they are advising, but always, suggested renal diet.
Yes, thank you, sir, for such an informative and inspiring
thank you, Anjali,
session.
thanked me.
Yeah.
Chicken piece you can avoid because that contains a lot of phosphorus. That will, see, to stimulate the appetite, little quantity, some pet parent they give. But if you can maintain with the renal diet, it's better. Otherwise, there is no vomiting. Also, will be a better.
That brings to the end of today's session in the
Yeah.
Drools Vetline Webinar Series 2026 with Professor Dr. M. Chandrasekar. And also a quick reminder to please fill out the certificates, the link which is posted in the comment box. A sincere thank you once again to Professor Dr. Chandrasekar for sharing his invaluable time, experience, and expertise with us. We hope today's session provided you with a meaningful insights, practical knowledge, and a strong step towards your professional journey. And a reminder, it is just the beginning. The Drools Vetline webinar series will continue throughout the year, covering clinical advancements, business skills, personal development, and technology-driven veterinary care. At Drools, we are proud to walk along the veterinary community, not just as a pet nutrition brand, but as a committed partner in your growth and success. Thank you for being the part of this learning community. We look forward in seeing you again very soon. Thank you. Thank you, sir.
Okay, thank you very much. You go through my slide, you will have an answer for your calcium and phosphorus also, according to Akash Senapati. Thank you very much.
Thank you, sir. Thank you.
Okay, Dr.